So when we do what we kind of call, I guess we call it a systematic respiratory assessment, and we always start with a FeNO test to start off with, because what we want to kind of avoid is breathing off of any kind of exhaled nitric oxide, which can happen from things like doing spirometry. So the order that we go through assessments is usually do a FeNO first. Then actually what we also do is we add in a kind of a sniff test. So we look at kind of peak nasal flow as well, to make sure there's kind of no issues with the kind of flow through the nose. And then we do a spirometry assessment, so kind of just a maximal spirometry assessment. And then we'll go into doing the challenge. So if they have a normal lung function at rest, we'll do some form of provocation challenge. Usually that's what we call an indirect airway challenge, which basically means we try and give them a challenge that might trigger off an inflammatory process inside of their lungs, which then brings in a bronchoconstriction. Those challenges could be an exercise challenge. They could be what I've mentioned earlier, eucapnic voluntary hyperpnea challenge, which kind of mimics the breathing that you do during exercise, but allows us to control the gas that individuals breathe, so it's cold and dry. Or we do what's called a mannitol challenge, where you inhale increasing doses of mannitol, and that potentially can kind of bring about almost kind of trigger off an asthmatic response in a similar way to an allergy kind of allergic kind of reaction. And so we tend to do that, and then after we've done the challenge, we only obviously do one at a time. But after you've done the challenge, you then measure spirometry again. If it was an exercise or EVH challenge, what we do is we measure spirometry about 3 minutes, 5 minutes, 7 minutes, 10 minutes, and maybe 15 minutes, depending on what we're seeing. And what we're looking for is the amount of air in 1 second that you breathe out as fast as you can. We're looking to see if that changes or not. So the value is called FEV1. And if your FEV1 kind of remains within 10% of your baseline, that would be kind of a negative challenge. So it would kind of be, we suggest the individual doesn't exhibit any form of asthma or EIB. But if the drop in FEV1 is greater than 10%, then that would suggest the individual has some form of asthma-related condition. If you've done an exercise or EVH challenge, might be exercise-induced bronchoconstriction. And again, obviously, then we kind of package the testing up in a report, send that off to their medical officer or the GP, and the final diagnosis is made from there.